Low blood pressure, also known as hypotension, is a condition that often receives less attention than its counterpart, high blood pressure. Yet, understanding when low blood pressure becomes a cause for concern is an essential aspect of maintaining overall health. Blood pressure is a measure of the force of blood pushing against the walls of your arteries as your heart pumps. A reading below 90-60 millimeters of mercury is generally considered low, but what does that really mean for your body, and when should you take action? For many people, low blood pressure is not a problem at all. Some individuals naturally have lower readings, especially young adults and athletes, and may feel perfectly healthy. In fact, low blood pressure can even be protective against heart disease and stroke. However, in certain situations, hypotension can signal underlying health issues or lead to symptoms that interfere with daily life. Recognizing these signs is crucial. The most common symptoms associated with concerning low blood pressure include dizziness, lightheadedness, fainting, blurred vision, nausea, fatigue, and trouble concentrating. These symptoms often occur because the brain and other vital organs aren't getting enough blood flow. Sometimes these symptoms appear suddenly, particularly when standing up quickly, a condition known as orthostatic hypotension. While an occasional dizzy spell may not be alarming, repeated or severe episodes should prompt further investigation. There are several reasons why someone might develop low blood pressure. Dehydration is a frequent cause, especially in hot weather or after intense exercise. When the body loses more fluids than it takes in, blood volume decreases, causing blood pressure to drop. Blood loss from injury or internal bleeding can have a similar effect. Certain medications, such as those for high blood pressure, depression, or Parkinson's disease, may also contribute to hypotension. Medical conditions like heart problems, endocrine disorders, severe infection, septicemia, or nutritional deficiencies can all produce low blood pressure as a symptom. In older adults, low blood pressure may indicate a decline in the autonomic nervous system's ability to regulate blood flow. For pregnant women, changes in circulation are common, but persistent or symptomatic low blood pressure should be discussed with a healthcare provider. So when should you worry about low blood pressure? If you experience frequent or severe symptoms, such as fainting, confusion, or persistent dizziness, it's time to seek medical advice. These symptoms could indicate a more serious underlying issue that requires prompt attention. If your blood pressure readings are consistently low and accompanied by symptoms, or if your readings suddenly drop much lower than usual, it is important to contact your healthcare provider. They may recommend blood tests, heart monitoring, or other diagnostic procedures to identify the cause. In some cases, hypotension can be a medical emergency. If low blood pressure is accompanied by chest pain, shortness of breath, severe headache, weakness on one side of the body, or signs of shock such as cold, clammy skin, rapid breathing, or confusion, seek emergency care immediately. These could be signs of heart attack, stroke, or severe infection. Managing low blood pressure often involves addressing the underlying cause. For mild cases, simple lifestyle changes may be enough. Drinking more fluids, adding a bit more salt to your diet, under medical supervision, wearing compression stockings, or rising slowly from a seated position. For those whose low blood pressure is medication-related, adjustments to dosage or switching medications may be necessary. Ultimately, low blood pressure is not inherently dangerous for everyone, but it's important to pay attention to your body's signals and to communicate any new or worsening symptoms with your healthcare provider. By staying informed and proactive, you can ensure that your blood pressure remains at a level that supports your health and well-being.